All right. Good morning, Shweta. How are you doing today?
Hi, Zarine. Good morning. I'm doing great. How are you doing?
Good, good. Thank you so much for joining us for this call today to talk about essential oils and physiotherapy. So do you want to go ahead and introduce yourself a little bit to our audience?
Yes, and I'm so excited about this topic. It's we're going to talk about essential oils in PT use. My name is Shweta. I'm a physiotherapist and a yoga instructor. I've been practicing in Pune currently after working in Seattle for almost 10 years, and mostly doing telephysiotherapy, telehealth, and also doing some one-on-one with patients. So this is pretty much it, and I think I do will surely more talk about the essential oil as we go through. So
Okay.
can you tell us more about yourself, Zarine?
Yeah, so I'm Zarine. I've been in India for about 11 years now, and I'm also a yoga instructor. My specific focus is prenatal and postnatal. And I've been using the essential oils for about 7 years now, where I was actually introduced to it in one of my pregnancies, and it's a definite game changer. So alongside that, I also educate about essential oils. I'm also a holistic health coach. And I guess in my past life, not that long ago, I was an engineer as well. So how did you get into the oils?
So, you said, I think the pregnancy just changed, it's like a game changer. So, I think for me as well, my yoga instructor, when I was doing prenatal yoga, she introduced me to this oils, and I used the lavender oil during my labor, so active labor, and it helped me with the anxiety, my pain relief, even during the active contractions. So that's where it all started, I would say, actively. And of course, I've been researching more and more and getting in touch with you. So you have been educating me more and more about it. So I love the theory behind it. And when you actually apply it, I think it works. So,
Yeah. And that's such a big thing, because I think especially that's the biggest, probably most impactful time as women is when we go through pregnancy. That's when we start changing so many things about our lifestyles,
yes.
and just becoming more aware as to like what other toxins we're incorporating in our lives and what we shouldn't be. So
Right.
this is kind of where we're hoping that to just share this information with men and women, that these are natural alternatives that they can be using to support their well-being in a completely safe environment. So yeah, as a physio, can you tell us how you use and integrate essential oils into your practice alongside physiotherapy?
Yes. So there are a couple of ways. One is, of course, I've been doing currently with the pandemic situation. I've been recommending this deep blue. It's a rub, and you can maybe tell us the background about it more. I have been, recommending this to my patients, especially for muscle aches, joint aches, even just soreness post workouts. And I think uh, even doing some Zoom or tele physiotherapy post once they receive it. So that's one of the models that I've been working with, and direct application of it for manual therapy. We do a lot of manual therapy, soft tissue techniques. So I can say this, when I was working directly in the clinical model, we used to use biofreeze. People in India use Volini. So I would say this is a great replacement. I would for those kind of rubs and gels, and considering that it is all natural and it is much better than those. So
Yeah, so I guess just a little bit more about like the technical side of it. So the essential oil is all plant-based. It all comes from your essential oils, which are coming from your roots, your bark, your stems, from everything from your trees. So the deep blue, so as Dr. Shweta had shown, it comes as like a lotion, or it also comes as like a bottle, an oil bottle. So the ingredients in it that it has is your DoTERRA, which is very common for most Indians, which is wintergreen, your camphor bark oil, peppermint, ylang ylang, helichrysum, blue tansy, German chamomile, and osmanthus. And that's where it's very safe to be using for across all ages, right? So even if you have younger children, as you kind of get those growing pains for younger kids, this is great where if they're doing physiotherapy, they can always go ahead and take this home and apply it. So it's not something that even if the patient is an elderly patient that's coming to see you, they can use that same rub for everyone else in the family to support them for all different types of ailments. So that's kind of where it's really nice to be able to just massage it either into their back, into their hips, into their joints, anywhere that they might be having any of that tension. And it's a great, perfectly natural solution. And as you'd mentioned, you have a lot of your clients are either from abroad or their parents are in India. This is like a beautiful way to be able to just order a bottle for them and gift it to them, that even in between those sessions or alongside with your session, you can guide them through how to use it safely, how to use it correctly, so that they're getting the maximum impact and benefit from it. So that's something that like your kids, like as like for elderly, their kids can always like just kind of gift them as like a natural option to make sure that they're being taken care of and loved.
Yes, and those are, those are great points. I think as a PT, I do work with mostly elderly population and women's health. So, but it's great for sports injuries where I have used in the past, along with instrument assisted. We used something called as ISTM, or soft tissue mobilization, using instruments like washer tools, cupping, dried needling. There are various kinds, but post the treatment, there is a lot of soreness. So you can use it on the muscles directly, and this works much better, right? So especially with the pain relief, as well as it helps you relax the muscles, joint aches, osteoarthritic pains, and on even lower back pains. So I use it on myself. I have a 2-year-old, so I use it at the end of the day on, I would say, most of the days. So it does feel really good. And it helps you maybe, sleep, at least pain relief. That's what I can say.
Yeah. Yeah. And that's like, as you mentioned, like at the end of the day. So like one of the things that I like to do is, even like if any of you guys dry brush to get like circulation going, you can add a couple drops directly onto your dry brush. And then it's like a natural massage that you're getting. And it's like so beautiful. So like I'll like either switch it up between like deep blue or like lavender, depending on what type of effect I'm looking for. And it's like a great way to just kind of get everything absorbed into your skin. And that's where with essential oils, they're actually absorbed into your skin within seconds. So that's how quickly they are absorbed in. And that's where, again, you want to be mindful, where you'd mentioned the biofreeze, you mentioned Volini before. Both of those have a lot of toxins in them, where your skin is your largest organ. You don't want to be applying things on a regular daily basis that have these chemicals and these other toxins in there, because in the long term, whether you're going to be trying to better your health, you're in the long term actually hindering it, because of the fact that you're using a lot of these creams and lotions that have other chemicals that are going to be filling your body up with different toxins over a period of time, where you might not see it immediately, but you will see it eventually.
Yes.
So
yes, and that's so true. And I think because I've used both of them, and maybe even some more other gels on my patients, I can surely vouch for the deep blue, just because, one, you don't need a lot of it. You can just use a pea size amount. A small amount goes a long way, even for a bigger portion of your neck or your back, right? And the other reason that I use it is it's non-greasy. That is going to help with the absorption. Like it can work faster, especially it's non-greasy, because I have used the biofreeze. It takes a long time. It is very greasy and it feels uncomfortable, so people want to wipe it off, right? So I've used it in the past, so this stays and it will work faster for sure.
yeah. Do you find that at first patients are hesitant to try something natural?
Yes, so they do feel like that's a good question. I'm going to say like this. So what I do normally as a PT is I'm going to apply it on their, I will show it to them, and then try to apply on an area that they can visualize and they can feel the effect. So I can say patients may be hesitant on a lot of things, especially to try something new, application of some new products. So I do, and because if it's hypoallergenic, it's all natural. So I would say surely that, check with your patients. If only if they're okay, do it. Apply it on areas that, or test it, right, for any allergy. I always do that with any products with my patients. So
yeah.
Yeah.
That's a really good point, is to always test it, because sometimes people's skin is more sensitive than the other. Because I've had clients where they found that it'll give them a lot of tingling sensation, which it is like a cooling effect, a nice tingling effect. But when you ask them and find out what happened or how they used it, they'll find, okay, well, they stepped into a sauna right after, or they went into a hot shower, and water will actually amplify the effect. So if they're finding like if their skin is like very sensitive, sometimes with elderly people, it gets more sensitive with age. They can dilute it even further. But as you mentioned, just like a pea-sized amount is perfect for them to be using. That's enough because they're getting the coverage that they need as well as the absorption, and it is very effective. So the less, the better.
Yes. And I do have a question for you related to this. So, I do use the rub. So if a patient or a PT wants to use it, so can they use the rub as well as the oil? How can they use it? Like meaning can they just use it topically? Can they mix it up? So
yeah. So like as you had mentioned, like sometimes they have like a lubricant agent that they might be using for some of the other tools that they might be doing. So at that time, it might be better for them to use the oil, which they can then mix in with aloe vera gel, and then use that to be able to get both of the benefits of the electrical therapy as well as the oil in there. And then it's also patient preference. So sometimes people like an oil, sometimes people like a cream texture. So that's where it's more personal preference because the ingredients are very similar in both of the products. So it just kind of depends on what they're looking for. I find the rub is nice for especially sportsmen, athletes. It's nice to just toss into your gym bag after you're done like a workout. You can just rub it onto your legs or onto your arms, anywhere where you might be feeling a little sore, having some of that tension in. So that's where it's, again, depends on the person and kind of what they're looking for because they are the same product. So they would basically be getting the same benefits from both of them.
that's awesome. And so basically, I think I can say this that as a PT, if you have a clinic, then you can also use a bigger bottle of this. I think I've seen it on doTERRA website that you can a pump bottle, right? So it's much more economical, and it goes a long way, right? I think.
Yeah, it's like a 32-ounce pump bottle. Yeah, so it's quite large, and like especially if you're going to be using on your patients regularly, it's more cost effective for the PTs to be having like one of the larger pump bottles in the clinic, and then like having the smaller tubes or the oil bottles for retail for them to be able to share that with their patients to take home.
Okay, great. And so, talking from the business standpoint, so can we make this as also, can we get an income out of it, or maybe, you know, yeah, so you can maybe tell us more about it. As a PT, we work with our patients directly. So I have been actually recommending the Deep Blue to a lot of patients. So that something that you would, suggest as a business side of the.
Yeah, I think it's like with anything, anything that benefits the customers or the patients should be offered in a clinic setting or for them to be able to take home, because it is so important when you have something natural and when you have something that's going to be so good and beneficial for your patients. This is where you're able to offer something to them, but then you as like the physiotherapist or the practitioner are able to also get a benefit where you are able to earn profits off of each sale as well. So that way it is like a win-win situation for both people. So that way it's not just something that the practitioner is putting in their clinic and they're just offering that to their patients. It's something that they're also able to earn a residual income from that, in addition to the patient getting the best benefits.
Yeah. Okay, so that's great. Something that you can expand as part of as a PT career. And I think I have been doing maybe a little bit of it, but I love it. So I think for pain relief per se, I think I have been surely working with my patients closely to discuss about the essential oils. And is there any other essential oil for pain relief like that you would recommend? I know I have used lavender personally. So is there any other that you would recommend?
Yeah, so there's quite a few. So I guess to start with, let's kind of define pain. So I think for most people,
Yes.
they define pain as like a physical pain, but pain can also be emotional pain. It can be acute pain. It can be chronic pain. So depending on what type of pain they're having, I would say there are different essential oils for recommendations based off of that. So for example, for emotional pain, which then eventually develops into physical pain. So that's where if it is like grief, tragedy, trauma, anything that they may be going through or experiencing, there are so many different oils that can be recommended to support them, like citrus oils. Like even, for example, if you peel an orange, you automatically gives you like a mood booster. So that's where a lot of the citrus oils are really nice for elevating your mood, for supporting your mindset, your focus as well. So there are different oils that can be used to support that. Some of the other ones like that you might be using for back tension, for head tension that you might be having, the deep blue is a great one. Frankincense is another one. One of the other ones that I typically recommend is the Aroma Touch blend. So this is a blend where when you're able to use it, you can either do it for hand massage. So they actually have like a certification for Aroma Touch hand massage, or across your back, depending on what you're using it for. And this is something that caretakers can also do for their clients. So this one has in it peppermint, marjoram, basil, grapefruit, and lavender. So this has like all those amazing oils, similar to the deep blue, but slightly different because it has like that lavender in it. So it's also really nice for just relaxing, soothing, calming. It's a really nice oil for that. In addition to some of the other ones are with emotional pain, your gut is typically the one that gets the most affected. So your gut is like your second brain. The digestin capsules are really good. There's also peppermint capsules, which are enterically coated. So there's been research that says that capsules that have been enterically coated with your essential oils are basically able to be digested in your intestines, which is where you actually want them to be dissolving and not dissolving in your stomach acids, because that's where you want the benefits to be. The next one is copaiba. So this is like a great one. This also is like a soft gel, enterically coated, where you're able to take that in for any head tension, helping with releasing some of that body tension as well. That's like a great oil that's there. And then similar to in the Aroma Touch, it mentioned basil, it mentioned marjoram. Those are all really good herbs and oils that can be used to support the body in the way that you're looking to get benefits from it. So it's like the blends are probably the most ones that I would recommend, because they kind of have everything else combined into one bottle. So that way you don't have to pick and choose. You're able to just use the blend directly and it works beautifully that way.
Yes. And those are, I think I would surely say that every patient that I see has the multiple pains that you mentioned, right? So, I mean, the patient will come in the clinic, but if you don't approach the patient holistically, like a whole, with chronic pain, emotional pain, physical pain, this, they may not tell you everything, but you can see that. So these oils are surely going to work on a lot of things. I'm just going to share one more experience that when I used to go to yoga, actually in the studio, the yoga teacher used to just rub it on the hands during the shavasana, and then just go around in the circle on each and every one of us, and then put it on our let us smell it, and it will help us relax. So it is something that even whoever is practicing as a yoga instructor, or in your clinic or wherever you are, you can just help relax as well, or with the pain. So it does help you with multiple reasons, multiple benefits.
Yeah.
So,
And that's like, it's so true. Like, that's probably one of the my favorite things that I love about yoga or in-person classes is like the pampering that happens during Shavasana, which is always nice. But I guess like that's also like always be mindful of the patients and the clients, because not everyone likes aroma or likes the smell of oil. So always ask them beforehand. And then again, with like lavender oil, you've mentioned lavender oil throughout pregnancy as well as for supporting with pain. And that's where lavender oil is one of the most adulterated essential oils, where we have to be very mindful as to where we're buying the essential oils from, where they're being sourced from, because we always want to make sure that you're using the purest of essential oils. Because we've mentioned earlier, your skin's your largest organ, as well as when you're breathing something in, it automatically crosses your blood-brain barrier so that it's affecting you completely. So even, for example, like I have a friend that uses the deep blue oil for a shoulder ache that she gets. So she doesn't want to apply it topically. So she'll actually just hold it up to her nose and breathe it in, and find that that's so effective. And that's where, when you're using essential oils that are so potent and powerful, you don't even have to topically apply things sometimes. That just breathing it in, you don't always understand the science behind it, but it's so important that aroma can alter so many different things, especially like your mood, your mindset. And that's where the emotional aspect of pain is a huge thing.
Mhm. And it's not discussed much about, right? People think about the physical pain, but like you said, the aromatherapy works so well, I should say, and we don't use it, or we don't work on it as much. I realized it only, I would say, I mean, I have been a PT for almost 10-12 years now, but till I was in the labor, until I actually started just using the bottle of lavender oil and sniffing on it through the contractions, I realized how effective is it. And like you said, that the deep blue, she was just smelling it,
Yeah.
and it works. I still do it when I have panic attacks or anxiety, and
Mhm.
it's, you don't have to do anything else, just taking a smell of it works. So I still do that. Yeah.
Yeah.
Yeah. And I think, is there I just have if anybody has to reach or get these oils, can they reach you directly, or about the deep blue, can they contact me?
Yeah, I would say they can contact either of us.
Mhm.
And then that way, like if there's anyone that is looking for more of a physiotherapist, they can always reach out to you. And then that way you can also train them on exactly how they should be using them in a safe manner, in addition to the physiotherapy or other alternative treatments. Because you did mention a holistic approach, and that's how everyone should take care of their health, is a complete holistic approach. And not just people thinking that holistic health is like to the side, let's not partake in it, or let's not consider it. But I think that's like such a big part of everyone's lives now, that we do need to look at nutrition, you need to look at fitness, you need to look at movement, everything in together, to be able to integrate that. So at the end, we'll put both of our details, contact details, at the end of the video, so you can reach out to either of us to be able to get a hold of us. And these oils are available basically anywhere in the world. So no matter where you're located, reach out to either of us, and we'll be more than happy to get you started and give you more education as well, or answer any questions that you may have as well over about any of the oils or any of the other topics that we've discussed today.
Sounds good. So that sounds good. And I'll surely, say that as a PT, as a yoga teacher, I have been, using it directly. So that's why this topic is very close to my heart. So I think every PT should at least try it. There are even samples, I think, on DoTERRA website. You can also promote just giving samples to your family members or to your friends, PT friends. I have given it to some of my PT friends. So it's great. Try it out. That's very important. So
Yeah. I definitely recommend, like, this is something that all practitioners, sports therapists, clinics, like even sports schools, this is a great one for them to be having, because it is safe for like some of the younger kids as well too to be using. So this is like a great option for them to basically be integrating natural alternatives into their lives starting at a young age.
yes,
Yeah.
and that's great. I thank you for your expertise on this. And I think if any question, just send us a message or comment below. So
Yep.
thank you.
All right. Thank you, Shweta. See you.
Thank you.
Bye.
Bye.